So I want to talk a little bit about what we've seen today and what we've done today and some of the science behind it. So one of the pictures that you'll see in a second is a facelift patient who is 12 days post-operative, a wonderful African-American patient. And what you'll see is her incision line, you'll see her neckline, and we do a couple things differently regarding pre and post-operative care. And what we found is healthy skin heals better. Some people say healthy skin in, healthy skin out, but it's really critical as to early healing, especially in pigmented or African American skin, that is healthy so that it heals well. So check that picture out. Other things that are key are that she is nearly back to normal activity. She's 12 days out. I would say that if she went out to a party that nobody could tell that she had surgery 12 days ago, she had a neck and facelift along with facial fat transfer and feeling great. Another interesting thing that we've done today is some fillers. So I want to highlight just some differences in fillers. And so one of the reasons that hyaluronic acid fillers work is that hyaluronic acid is natural and normal in our body. And so I've heard some patients say, I've heard this only lasts 6 to 9 months or a year, and why can't it last longer? Is this just a ploy to make us spend more money? It's actually not. So the deal is that hyaluronic acid is a natural occurring substance in our body, and that's what these fillers are. And so when this filler gets injected into your body's like, what's that? Oh, that's filler. Okay, no problem. It's hyaluronic acid. So it identifies it and it says, I'm going to treat this hyaluronic acid the same way that I treat the other HA that's in our skin. And so that's what happens. But we have found, kind of through the hard way, that some of the patients who we try to use alternate fillers on, or long-lasting fillers, or even these permanent fillers that you may hear about, those ends up being disasters many times. And that's because the body says, what is that? I do not recognize this, and the body can begin to attack those. So consumer, be careful out there if you're being discussed or talked to about with permanent fillers, because it can end up being a permanent headache. So be careful about that. Okay. Other things is we can put fillers in with a cannula. That's this thing. This is a blunt tip, really advantageous because it decreases bruising, pain, and post-operative risks, including intravascular injection. And then the other way we can do things are a needle. I use both, but it depends on what exactly I'm doing and what exactly I'm trying to accomplish to determine which I'm going to use. So I want to just paint a picture. If you can zoom in here, the difference in these two fillers here. So that's a filler that's typically known for holding its shape quite well. Okay? Now, okay, so you can see right off the bat that this is not holding its shape like this is, okay? Then, let's go to one that's even a little clumpier. I apologize. Okay, it's coming out okay. All right, so these fillers, these are 3 different kinds of fillers, are rated on what's called the G prime, and that is a universal standard measurement that talks about how clumpy or how much they lift, okay? And so this is Restylane Lift. This filler is gonna add a lot of volume to an area. Make sure you zoom in on that real well. But this is gonna add a lot of volume, but the downside is it could be clumpy. So you can see it's a little bit clumpy. This is Restylane. This is one of the standard fillers. Really great. It's kind of the classic, but it holds its shape really well and isn't too noduly, but can, especially around the lips or tear troughs. And then this is a special kind of a formulation of Bellatero that I've added a little bit of lidocaine into, and how much is my own secret. But you can see that this filler is not clumpy. This is excellent in certain places. And so it adds volume, but it's not going to be clumpy. And so if you're somebody who's very wary about nodules and you've seen these kind of things, you'll want a filler that's softer like that. Okay, so that is just that's a little bit of filler 101. There's a lot of different kinds, but these are all hyaluronic acid fillers. They can all be dissolved in a heartbeat if we want to with hyaluronidase, which any office who does fillers like this should have that on stock, a bunch of it, just in case. We're about to do an upper eyelid blepharoplasty consultation, and so we're gonna go do that. And if you have any questions, send them to us and we will respond. We love that, so bring it on.